Hi, this is Dana Rockey, and in a previous video I talked about the importance of sleep apnea, its definition, why it relates to the oral systemic component, and why we screen for that in the dental office or help screen for that. I think as dentists, even though we cannot make the official diagnosis of sleep apnea that is done by someone with a medical license, we have a unique opportunity here in the dental office to get in on the ground floor of the screening process and the education process to help get patients going in the right direction to possible treatment. A big part of that here is the screening process. And we already know that when patients come in, we take an extensive health history. We learn from their family history, do a clinical exam at the chair side. We can see signs of wear and other issues. We can check size of tongue. And I have a screening form here. I think that one of the most important parts of is the Epworth Sleepiness Scale. Drowsiness, daytime drowsiness is a big deal regarding sleep apnea, and we can actually help test for that and gather data. We put all that together, the sleepiness scale, other issues that we talked about, hypertension, diabetes, neck size, etc., body mass index, height and weight, and we can kind of paint the picture as to whether the patient might have a tendency towards sleep apnea. If it seems that there's a high probability of that, the next step, of course, is testing. And there's two different ways to do that, what I call home sleep testing and what I call in-lab sleep testing. There are pros and cons to both. I happen to like home sleep testing. The equipment is simpler. The biggest point for me is that you're sleeping in a familiar environment of your own bed in your own bedroom. It's done over 2 nights. The equipment is delivered to you. It's very simple, reasonable cost. The other alternative, of course, is to go to a commercial sleep lab, often associated with a hospital or a large private company that would do this. Yes, you may gather more data, but to me the big deal is the quality of the sleep that you get when you're being tested in an in-lab situation. That might not be as good as in a familiar environment like home over 2 nights. But in any case, from this we gather information that is downloaded and reports are generated and the data is analyzed, and from that we make the diagnosis, or the medical professional makes the diagnosis of whether the patient has sleep apnea or not. And in my next video, we'll go over exactly how that's done and what that means.